Buttock augmentation is a procedure that's become much more popular in my practice, and I've had many more requests for the procedure. That operation is not a singular operation. There are several techniques available. That procedure basically involves taking fat or liposuctioning fat from one area of the body and re-injecting that fat into the buttocks to augment or enhance the buttocks themselves. I've got a few examples here, and you can see here how the waistline has been contoured with the liposuctioning procedure, as well as the lower back has been flattened down with the liposuctioning. And the fat that was removed from those areas was taken and injected into the buttocks to offer an enhancement or an augmentation of her buttock cheeks. And you can see the nicely rounded shape that was achieved with her buttock augmentation, and as well as an enlargement or an enhancement of her buttock cheek, as well as a nice tailoring of the waistline and the lower back. The other procedure that I use in my practice is actual buttock implantation, where solid silicone implants are placed into the buttocks through a small incision, again in the upper buttock crease, so that the incision line is very well hidden and there are no visible scars. The implants are available in a few different sizes and shapes from a couple of different manufacturers. They can also be tailor-made to fit the particular needs of the patient if their parameters fall outside of what's available in the prefabricated arena. And you can see how nicely augmented and enhanced her buttock is in terms of its entire roundness and projection. That procedure can be coupled with liposuction as well to further shape and contour the buttocks. The third procedure that I employ in my practice is taking tissue actually and transplanting that tissue from one part of the body to the buttock area to enhance the buttocks. Primarily that's done when a patient requires an abdominoplasty procedure or a butt lift procedure along with their buttock augmentation. This is a patient who required an abdominoplasty as well as wanting an augmentation of her buttocks. So she had the tissues removed from her abdomen, the fat and skin removed from the abdomen. That fat and skin was then tailor cut to fit the size and shape of her buttocks and was inserted through a small incision here in the upper buttock crease to give her this nice enhancement, rounding out the upper portion of her buttocks, which was her primary concern.